Thank you, Mr. Chairman, and thank you for your comments, your testimony this morning, and for your leadership in various fronts around the country. Some very good suggestions. I think there's some general applicability throughout all of this. As my colleagues know, my lens in this committee really tends to focus on access to care in rural areas. And so I'd like to just present to each of you what you have shared with us is good, but is it workable in a place that is highly rural, where there is very little competition, where access to an MRI is not possible in your community and perhaps not even in your region, and so the effort to gain access to many of the things that others might just take for granted are limited. I note, Dr. Gross, you're in Florida. Ms. Damaras, you're kind of all over the country. We've got Tennessee, and in King County, you've got 2 or 3 times more people in King County than we have in our entire state. So can you share with me how what you have learned can also be applicable in high-cost, very low population areas where we simply don't have competition? Or is it an entirely different model? We've had hearings in this committee that are more specific to rural health care, but share with me what we can learn from you as applied to rural access.
Mr. Chairman?